All right, ladies and gentlemen, at this time, we want to welcome you to our program here at Focus on Liberia. And those of you who have already joined us, we want to say thank you and welcome. Today is Sunday and is our prime time Sunday. Our prime time Sunday show is when we sit with our fellow Liberians, many of whom are experts, to talk about issues that matter to not only Liberians but also the entire world. My name is Anthony Sie, and I'm co-hosting with my partner, Mr. Dennis Jai, and we are happy to welcome you to our show. Today we are discussing post-COVID-19. We know this thing too shall come. Shall come to pass. But when it leaves us, the impact is going to leave behind. How are we going to deal with that? So we will be looking at the impact of COVID-19, uh, our politics, health system, and all the issues that we always talk about. So today is a very important conversation. We have some outstanding guests. I will pass control over to my man Dennis Jad to welcome our guest, Mr. Jad.
Again, ladies and gentlemen, welcome to Focus on Liberia. We are broadcasting from Atlanta, Georgia. Last week, we dealt with the topic of the impact of COVID-19 on Africa, looking at health, economics, politics, and some social issues. Today, we are going to be looking into post-COVID-19 Africa. That is, after COVID is all said and done, what do we expect? How will Africa look like? Politically, economically, and otherwise? What do we expect to see? And with me to discuss this, we have Dr. Abdullah Dukle, who's coming back on the show. Dr. Duke, welcome to Focus on Liberia.
Thank you.
And also us, joining us from Nairobi, Kenya, Ms. Koto Reeves. For the second time on Focus on Liberia, we say welcome, Koto.
Thank you.
Also have joining us from Uganda is Baker Kabanda. Baker was in the Metro Atlanta area, but now he has gone back to Uganda for some time. Baker, welcome to Focus on Liberia.
Thank you, Dennis. I'm honored to be hosted on Focus on Liberia.
And this is the second time we are hosting Baker. The last time Baker was here, we were discussing African communities, and he represented the Ugandan community to discuss, just Uganda and how African immigrants in the U.S. Last but not the least, we have Dr. Heaven Dishiu. Dr. Dishiu, for this third time on Focus on Liberia, we say welcome to the show. You are muted, Dr. Dishiu.
I'm happy to be here. Thank you.
All right. Again, today we are going to be looking into post-COVID Africa. Last week, we saw the impact. This week, we're going to be looking into post-COVID Africa. So just let me go around the room. We here. Just give brief words about yourself so we can start the show. I know you've been here, you've introduced yourself before, but for the sake of today's show, just give us 2 or 3 lines about yourself. Again, let's start with Dr. Duke.
I'm a friend of Focus on Liberia, and I live in Maryland, USA, and back from Liberia.
Thank you.
I'm a writer, journalist, and was kind of into politics at some point in my life.
And right-hand person of President Salif.
Well, I'll say Amos or more. Salif, I was a consultant.
Okay.
Amos is my real political boss, but Ellen was my boss as a consultant.
Let's go to Koto, who's joining us from Kenya. Few words.
Sorry, Dennis, go ahead.
No, I said few words about Koto.
Yeah, my name is Koto Williams. I'm based in Kenya, working with ActionAid International. In Liberia, I work with the Liberian Feminist Forum. I'm one of the co-creators of the forum, and that allows me to have a continuous presence in the country in terms of dealing with the issues that affect women and girls, and also the sort of overall political and social system in Liberia, working for alternatives and offering alternatives to decision makers.
Thank you, Koto. Let me go to Baker Kabanda, all the way in Kampala.
Yeah, my name is Baker Kabanda. I'm an author. I'm an author of a book called Building Your Influence. A Pan-Africanist. I'm a digital marketing consultant. I own a company called Sese Media. It's a digital marketing agency. And most importantly, I'm a dreamer. I dream of the day that Africa will come together as one. And I dream of the day when humanity will learn to live together in peace and harmony.
We hope that day will come very soon. Let me go to Dr. Deshiu. Brief words about yourself.
Harvey Deshiu. My background is essentially I'm a biotech executive for a clinical stage biotech company developing blood volume expanders to treat septic shock and hemorrhagic shock. Also have a law background, particularly in intellectual property and regulatory law, health, food and drug law. As well, I have a science background, PhD in biochemistry.
Thank you, ladies and gentlemen, and welcome to Focus on Liberia. To all our viewers across the globe, we say welcome to yet another edition. We are now discussing post-COVID Africa, what's going to happen, or what do we expect to see. So let's begin with the area that everybody is familiar with, politics. COVID is finished today. What do we expect to see in Africa? And to begin that political talk, let me go back to Mr. Asuni, my co-host.
Mr. Ja, thank you. Fellow panelists, as you all know, I almost call you a fellow panelist. Maybe I might be right there. You know, politics in Africa is depressing for some people because of the way leaders come and the people aspirations are high, and in no time the people are like, no, this is not what we settle for. Hey, leadership is a very important thing in any country for that matter. We need leaders to provide that political will to get things done. We Africans need change. And COVID-19 has exposed quite clearly how vulnerable and weak our institutions are, especially our health institutions. So let us start with health. Ebola is history. We were hoping that with the coming in of COVID-19, we will be in a much better position than other countries. But some people are saying that is not the case. So let's start with you. They always say, ladies and gentlemen, let's start with Carter Reeves. The way the healthcare system in Africa as a whole is being exposed now has been weak, and our leaders don't have that leverage anymore to live and can't see healthcare in other countries. Is that something you think will change their thinking about how they improve the healthcare system in Africa as a whole?
Thank you. I've listened to this, I think more than once in the last 30 minutes, the issue of public health and vital public services. What does it mean as it relates to the disparity between different groups of people in our country? So one example that is being given is the situation with our leaders accessing health in different countries because there is an understanding that those health systems are better in terms of quality and I guess effectiveness. I think the context
Carter, are you still
of
with
our
us?
public health systems is not just a conversation it has a lot to, can you hear me?
Yeah,
Okay,
yeah.
now we can hear you.
Yeah, you can hear me? Okay, I think I see something about the internet being unstable. So I said that I don't think this conversation is restricted, both the conversation and the solution, if we're looking at post-COVID-19 context. I think a big part of that conversation has to do with neoliberal austerity measures in the global south. So if we agree, and I'm setting this premise that if we agree that international financial institutions and regional development banks, through loan conditionalities and policy advice that is sometimes, prescriptive, that context has had an impact on the public health systems. And it's based on that we have inherited over decades what we have now as the public health system. So issues around, privatization, for example. So the more the IFIs have said, let's have private sector delivering services around health, it means that the government itself has retreated in such a way that the government of Liberia would say, let's say, for example, Phoebe Hospital, the government of Liberia would prefer to say Phoebe Hospital is actually a hospital that is owned by the church and will provide subsidy. And Baker, I know you're not from Liberia, so please, excuse this example. But what it means is that, yes, Phoebe Hospital is partially owned by the church. I don't know the history, but the government itself is not recognizing that as a referral hospital that is serving a significant population across Nima County, Lofa County, Bon County. There are even people who come from Magibi and Monserrado County. They are in a way giving up their responsibility, not being accountable, because they believe that in a way, this is going to be served by the Lutheran Church. And the reason they do that is because of, first, we're talking politics. So what does it mean to support Phoebe Hospital? What does it mean to recognize the accountability they have as the state? What does it mean to provide public services for the people of Liberia? If this does not matter, then it means that they continue within a system where they are not doing that. And I think COVID-19, what it has done, it has exposed new evidence on the impact of underfunding the public health, public education, water, sanitation, all of that. We now see what this means when the only hospital in Monrovia, health center in Monrovia, that is, taking in people affected by COVID-19 is the 14 military hospital, which is, quite new structure. It wasn't even, prepared. They were not even prepared to do that. And this was just an ad hoc decision because there was a risk in taking people into the regular hospitals. So I believe that the conversation is a national one, but it's also a global one that says, what are these advice, pieces of advice, prescription that is being given around how country invests their resources into public services linked to loan conditionalities. So if the government has to pay the loan and there are conditions around that, what is the trade-off that they're making? And what does that mean for the people of Liberia or for any other country, for that matter, on the continent? So I think my first point is that we elevate the conversation to the point where we're understanding all of the different factors. And the factors, yes, they remain with our governments, but there's also a larger system.
Thank you.
That neoliberal system that we're dealing with, that even if the government has the political will to, invest in public health, scale up budgetary allocations, they may not be able to do it because of loan conditionalities. So what is the conversation on that? So I will stop and give, space to my other panelists.
Yeah, let's come to you, Dr. Dishil. What Corona has done is not new. Ebola did that. And
right?
still we are in the same space. Just, I don't know what else are we waiting for as a country, or what else our leaders waiting for to say, hey, we are responsible for our own health here and it's about time to do so.
So I think the issue goes beyond, well, it's in response to infectious diseases in general. So there's several points that I've, sort of written down that I like to go through quickly. I think first and foremost, we have to, draft bills and provide funding to create sort of an office, you can call it a procurement office, whereby the government will, provide enough funding to encourage the not only just to buy and stock up on PPEs, which are masks, gloves, that sort of stuff, medical gowns, medical suits for doctors. So you establish an office to procure those things. In addition to that, you also can produce some of those things. A lot of those things are made of rubber and what have you. We could most certainly produce gloves, vinyl, latex, nitrile gloves. Those are things that the government partner with private industry could produce their own PPEs. They can produce their own diagnostic kits, testing and diagnostic kits to detect different diseases rather than always relying on foreign entities to do that. We have people that have the requisite knowledge. Prime example, I'm sure you've heard of him, Dr. Chris Young. He has a company that produces, that certainly has the ability to produce diagnostic and testing kits. As a matter of fact, I believe he's offered his services to the government of Liberia to do that. So those are things that can be done. We can produce our own testing kits. We can produce our own PPEs. We can also put money aside to buy those things. If you buy those, stock up on those PPEs when there's no pandemic, the pricing is a whole lot better, obviously, than when you're in the midst of a pandemic, because there's always price gouging going on and what have you. So that's one thing you can do. You can also fund modernized vocational training. For example, we can go beyond what BWI and Tadma High, what they do, right? We can modernize that to include, you do that in all of the high schools. You include in the curriculum basically what's referred to as industrial biotechnology, pharmaceutical drugs production. You can do that even at the high school level. You can start to do things like that. Basically, modernized vocational education, which will also include improving the STEM curriculum, science, technology, engineering, maths curriculum. So that's three. Another thing you can do is, most countries, you have these incubators where the government, public, private, they provide funding and they encourage entrepreneurs, to set up in these incubators. The incubators have a lot of logistical support. You get it from private and public. Personnel come there to do symposiums and what have you, to provide information to the entrepreneurs, and the government also helps to support that. So, you have a center all over. You can have one in each of the counties in Liberia, and those incubators will basically encourage people to go into not just biotechnology, but any kind of entrepreneur activity. So those are some of the few that come to mind. Another one that you could do is called bioprospecting. Everything that I've discussed requires money. So we have to find creative ways to bring revenue into the government. You can't just always rely, we have to be able to generate revenue. It's easy to talk about these things without any cost benefit analysis and what have you. It comes down to money. If you get involved in what's called bioprospecting or pharmacognosy, basically you open up, with appropriate oversight, of course, you open up the country to where you can, people can come in, companies can come in and prospect to try to identify basically pharmaceutical agents from all the different plants, animals, algae, fungi, all of those soil, all of those things have, potential what's called active pharmaceutical ingredients. So you do that with, like I said, with proper oversight. Those things will also increase the science and engineering capacity of the country, because you will then be able to include, university graduates that will have to conduct preclinical studies in animals, clinical studies. And then you can also, if you find something, you can patent it. It will be owned by the government and the companies. And eventually the government would secure revenue in the form of royalties from drug companies and what have you. You can then take the revenue and fund all of those other things that I was talking about: the incubators, STEM education, vocational training, and what have you. So those are, scholarships. You can extend it to scholarships, fellowships for medical personnel, which we need. We need to increase the number of people going into medicine. That takes money. So basically, you can use some of those ideas to generate funding, independent of what we're doing right now. We can generate funding from bioprospecting and pharmacognosy, as it's called, basically trying to identify pharmaceutical agents from some of the things that I mentioned.
So Dr. Deshie, before you end your thought, so after COVID is over, do you expect those things to happen in Liberia, in Uganda, in Togo, in the whole of Africa? Or what really can you predict has to, you think there's going to be an appetite for technology more?
I think some of it is happening right now. For example, I'll give you an example. In Senegal, they are producing ventilators, their own ventilators, cheaper versions of it, from using 3D printing technology. So we talked about, technology isn't, some of it is available now, that they're actually doing that right now in Senegal. They're producing their own ventilators. As you know, there's a big shortage of ventilators and a lot of COVID patients and other infectious diseases. When you get SARS and all of these things, typically you may end up on a ventilator. And there's always a shortage of that. So they are actually doing that. They also are producing their own kits, testing and diagnostic kit. I think they managed to produce it for about $2, which is relatively affordable. So some countries are doing that already as we speak. I think we need to do more of that. We need to rely on ourselves more. I mean, I know it sounds cliche, but you got to start somewhere. You have to start somewhere and start doing, we have to prioritize those things. Because, as you see in COVID, everybody is taking care of themselves, right? You can't expect the French or the Spanish to send you anything when they're dying too. So basically, everybody's on their own. So we sort of need to think more inwards and those things also amongst ourselves and what have you. The expertise is there. We just need to prioritize it.
Thank you. Let me come to you, Mr. Kabanda. I know sometimes we make reference to Ebola. Ebola was just 3 countries in West Africa, 3 or 4, a couple of countries in West Africa. But with COVID-19, this is global. The global economy is down. And in fact, the places we used to get things from, we're not getting them from there because of COVID. So after COVID is over, Mr. Kabanda, what do we expect to see happening in Africa? And we're beginning with the health sector. You can unmute yourself. You are on mute. Yeah, good. Go on.
Okay. First of all, I'm inclined to believe that COVID is still around for quite some time. I don't envision it disappearing because talking of vaccines, the vaccines are expected to come in about the next 18 months, and that's not for sure as well. So my thought process is we are going to have to figure out a way to live alongside COVID, the same way we are living alongside things like cancer, we're existing alongside things like HIV. From the East African point of view, Uganda being my vantage point, I've noticed that the leadership here in Uganda has gone ahead to try and improve the health sector. They're looking into the salaries of the doctors and the health workers who are now considered as essential workers. I was looking at Kenya the other day. President Uhuru Kenyatta came up with an 8-point stimulus package. And part of the area that he was looking at investing in is the health sector. They're looking at more beds for the hospitals. And interestingly, they are going to have to procure those beds from what they call the Juakwali, the local people, which is a very good thing for the economy. Certainly people are getting jobs. I'm looking at Rwanda. Rwanda has gone into technology. They've purchased robots that are in position to do tests of 50 to 150 people in a space of 5 minutes. If I look at Burundi, Burundi has taken a very interesting stance. Actually, they just concluded the presidential election, just so you know. In the midst of all this lockdown and everything, Burundi didn't really care much about that. They went ahead and had a presidential election, and they just elected their newest president, I think on March 20th. Tanzania has taken a different approach as well. They're not locking down as such. President Magufuli has been very adamant to lock down the country. And he did something that was rather interesting. When he got test kits from China that were donated to Tanzania, he actually went ahead and put samples of papaya, which is pawpaw, samples from goats, samples from vegetables. And what's very interesting is that when those samples were tested, they all returned positive for COVID-19. So the vegetables were tested for COVID-19 and they returned positive. The goats were tested for COVID-19, they returned positive. So that created a discussion around the kinds of stuff that we receive from these other foreign countries. China donated the test kits. The test kits were used in a laboratory, and things like vegetables were testing positive for COVID, which has created another conversation around the whole concept of COVID. Is it something that is being blown out of proportion? Are the numbers we are working with actually genuine numbers? That's a conversation that has been circulating from the skeptics. Along the same lines in the medical field, I'm going to look at Madagascar. Madagascar has gone ahead and come up with the COVID organics. The COVID organics has resuscitated the conversation around herbal medicine in Africa. So prior to the advent of the white man, Africans had their own traditional ways of healing themselves. And I'll tell you this for a fact, these things were effective. If you have a cough, you get some leaves from a mango tree, you boil them, you put a little bit of honey, and you're good to go. And unfortunately, mango leaves and honey is not certified by the World Health Organization. So the World Health Organization today will tell you that that doesn't work because we have not certified it. But we need to appreciate the fact that the World Health Organization is funded by pharmaceutical companies. The likes of Pfizer are the ones that determine the protocols that are used to determine whether a medicine actually works or not. So that brings us back to the question of Madagascar. Madagascar coming up with a herbal medicine, that's direct competition with the pharmaceutical company. So they are not about to let something like a herbal remedy from Madagascar take center stage. So there is conflict of interest here. The World Health Organization is funded, the leading fund of the World Health Organization until recently has been the United States of America. In 2019, they invested $400 million. The second biggest donor to the World Health Organization after America has been the Bill and Melinda Gates Foundation. Now, Bill and Melinda Gates Foundation, these are the leading proponents of vaccination. Now, what happens with vaccines? Vaccines can be patented. So someone can have ownership over the vaccine. So once they sell it across the globe, they get to make a lot of money. Now, for these herbal remedies of ours, the boiling of the leaves, all these other potential other remedies that could be explored cannot be given a chance because somebody cannot patent boiling leaves and adding honey. So naturally, that is being cast aside. But we as Africa need to understand that we need to come up with African solutions to problems that are affecting our people. When I look at the COVID-19, actually the scientist who came up with the concoction is Congolese, not even from Madagascar. The guy is Congolese, he comes up with a concoction. Apparently they say it works. We as Africa, we have the honors to go ahead and test its efficacy. I know the African Union has taken on the mantle to try and do some testing to confirm whether the drug actually works, which is a good thing. We don't have to depend on the likes of the World Health Organization to test things that we as Africans can use on our own. My take on the COVID organics, for instance, is if the rest of the world doesn't want to use it, it's okay. Let those who believe in it actually use it. And I believe Nigeria has ordered for a shipment of the drug. Tanzania has ordered for a shipment. Guinea, I think it's Equatorial Guinea, and a couple of other African countries have ordered for this remedy to give it a shot and see how far it goes in as far as helping avert the crisis is concerned. So this COVID-19 has turned out to be a blessing to Africa. We are turning to our own solutions because we don't have a choice. But these solutions have always worked. I'll give you an example. We tend to look down upon everything that is African, and we tend to look outward at things from the West and the East as the only things that are heaven sent. In 1879, in Uganda, people were carrying out cesarean section. In 1879, African people were carrying out cesarean section on women trying to give birth. So we need to believe in ourselves. We need to believe in our solutions to these kinds of problems. We need to look at, for example, right now, the whole world is looking for a vaccine. If you look at the whole concept of the vaccine, when the vaccine shows up, it's most probably going to come from the West. And the little money that we have, we are going to get all of it. All these loans we are getting from IMF and World Bank, we're going to get all this money and give it right back to them in exchange for a vaccine. There's absolutely no reason why we don't get our own vaccine. We have the scientists. We have the best of the best. Right now, the gentleman heading Trump's team on looking for the COVID-19 virus, COVID-19 vaccine, is a Moroccan. He's called Sloane. This is a Moroccan. He's leading the team in the US trying to look for the vaccine. This guy is Moroccan. So there's absolutely no reason why we should not believe in our own people, why we should not turn to our own remedies to try and solve African problems. The issue of vaccination, again, thank God, because normally when diseases come up and pandemics, it's an African thing. Africa is the poster child for poverty and disease. So normally the vaccines that are made, they normally ship to Africa because most of this is Ebola, Africa. All these are diseases, Africa. But this time around, this is a disease that has affected the entire globe. So the people that are trying to come up with a vaccine in the Western world have faced a huge backlash. The Western world, because if this vaccine shows up, it's not going to be injected only in the bodies of Africans. It's going to be injected in the bodies of the white people. It's going to be injected in the bodies of the Asian people. So now all of a sudden, they have all woken up. They are getting to criticize vaccines. If you look at vaccines, for instance, Robert Kennedy Jr. has just won a case against the United States government, contesting the efficacy or safety of vaccines. So the vaccines themselves are not safe. And if the United States government cannot defend its own vaccine, why should this vaccine be sent to Africa and injected in African people?
Thank you, Baker.
The French people. Yes.
Yeah, thank you. Let me. You have introduced another dynamic. Let me go to Dr. Duve and hear his take on what we expect to see after COVID-19, health-wise in Africa.
I think if I listen to my colleagues, we talk about the fact that Africa is dependent. The Koto, especially, we talk about this neoliberal concept that is running the world, that set up the conditions for everything. And that is a very good case, because when you depend on the outside money, and the way they give you money determine how you're going to do things. I remember during Ebola, they're building these centers, with, I don't know, they were like, and I asked somebody, I said, why don't you guys build one big one? They said, no, we're not supposed to build anything that lasts. Whatever we build is supposed to be dismantleable after we finish. That was the condition for building these centers in reception centers for Ebola. And we Liberians, of course, didn't have the money to do it. They depended on the US and other people to build these centers. And then after they left, they're gone. Research continued on Ebola. We don't have money to do research. We don't put money into it because you're battling between how to pay your workers, government workers, or how to pay school teachers, and how do you get money to do research. All of this is because our system, we have been put into a system, again, this neoliberal concept of, a marketplace and all of that. We are living in a world where we don't control money, and we don't create things at home that put us in control of the money, of the resources. Every time we talk about, oh, do we get money? Are we going to get loan? Can we stop thinking locally? How do you create institutions to meet your needs that you can afford, rather than create institutions to respond to global appeal? That somebody will give you money, will give you, like, there are so many examples, like somebody say, oh, I'll give you money, but you have to borrow some of it. So I think, that this aspect has been very well covered. It's depending now what governments will do. Are they going to look ahead and say, okay, can we start working in the Manu River Union, the countries that went through the Ebola? What lessons have we learned? What can we put together? And then we have the WAHO, the West African Health Organization, which is very effective. Went to Liberia, did great job. And then from there, you get to the CDC in Addis Ababa, which is now under contention, because now, but how can the CDC in Addis Ababa be independent if the US is paying 15% of the salaries, is paying the director, and then China is coming in with $80 million to build a center? Can we say, no, if anybody wants to help, give us the cash, we find out how to do it, rather than bringing people into institutions that are supposed to be Africa-centered? So this is the politics of health that I'm looking at. That you don't do these things by looking outside. When we talk about everybody's worried about COVID-19 because he attacked the European world. But while we are talking, 10,000 people are dying of malaria every single day, and nobody has ever said, "Hey, malaria need to have a vaccine," because that kills 10,000 people a day. But pharmaceuticals make money out of it. So how do we bring the conversation back to ourselves and say, what can we do at home? How do you create a laboratory in Africa with African conditions and using African plants, using African students, using African doctors and African sick people to say, this is the medicine we need? We don't even know what we are taking. So I think the conversation is, the idea is, how do we bring the issue of health into our development projects to make it as an essential part of development? You cannot develop if you don't have a healthy people.
And how are we responding to that question?
How are we responding to the question? I think I'm afraid that with the conditions we live in, the political conditions, the neoliberal political system that we have, after COVID, we just clap and then say, dance, kumbaya, and everybody goes back to the old system. We go back to zero, which is bad. Instead of saying, we are at a point where we need to know, because we are close, we shut down the continent, but there's no proof that COVID kills more than malaria. We have no proof that, whatever effect it has on Chinese people or Europeans is going to be the same effect on Africa. You see what I'm saying?
Let me come to you, Koto, so we can conclude on the health part of it. Looking at Dr. Deshiu talk about, there's the kids pharmaceutical, and he said that a few countries are, responding. Baker is kind of skeptical of the Western solution. Dr. Duke is wondering why, the emphasis is on COVID more than malaria that kills even more. So, what do you think about that, and how do you conclude looking at everything that you've said so far on COVID, healthcare in Africa?
Well, the response to the post COVID-19 context will definitely be in phases. So there will be the immediate action. What are the things that we do immediately? And then there'll also be, long-term responses that look at, and I think generally what we have to look at would be, how do we transform the system? How do we push for systems change and recognize that COVID itself is affirming the fact that the struggle by, different actors, focusing on a more just and equitable world with all of the different services that we're talking about. We have to look at the connections. We've talked about what's happening at national levels. We've talked about what's happening globally. Do we connect and work? Do we become independent in a way that Africa is functioning in an effective way without questioning, the quality of what we get? So I believe that the overarching goal is really about systems change. What is it that has worked in the past in terms of health systems, public services? What is it that we would like to change? So that brings in an element of what everyone has said. So from Baker, what I understand is that we have to develop the trust in our innovation and, test it out. Does it work? Does it not work? As opposed to, stepping away because this is not coming from, a country that we usually rely on for solutions. From Doug, there's also the conversation about what do we do when we get stuck in this neoliberal rut, because it contributes to where we are. We can, like I said before, we can have all of the, political will, but when there is an issue, haven't mentioned it, infectious disease, I can assure you that no government in the world is going to tell WHO that we're going to have a meeting by ourselves and we're not inviting you. Or there's an outbreak of, say, Ebola. No one is going to say, CDC, you cannot, join us, because even before COVID-19, you definitely had all of these players on the ground and working together. It's a collective. It's a recognition of globalization. I'm not a fan of globalization. This is the reality that we have. So do we want to transform the system in a way that we admit that globalization in its current form is no longer working for us? And then the issues that haven't bring up about, public-private partnerships, being able to build from the ground up, understanding, that there are existing resources. I think all of those things are important in terms of transforming the system. So the goal, I think, of post-COVID, what we do around post-COVID context is really to say, how do we change this system that we believe has been working, but it's not serving everyone? What do we do about it? I think that is a political mandate for governments and civil society.
And talking about political mandate, let's see post-COVID politically. Anthony, you.
Thank you, Mr. Jal. Post-COVID politically, this time let's start with Dr. Duke. Dr. Duke, come back. You've been around, you've been in the political arena. Tell us, what should we expect?
I have to relocate temporarily. Sorry.
All right,
Okay.
all right. Dr. Duke, what should we expect politically after COVID-19, given all we've seen so far now?
I'm just worried that my fear may be confirmed that we'll go back to status quo, which is we go back to just what happened with the Mano River Union, with the Ebola is gone. Everybody came to help, it's gone now, so we go back to zero. But on the political side of it, a lot of things happening. There's no, easy way to put government forcing people to stay home without proof. Staying home, confining people without know exactly what the effect is, because we never had these things before. We just heard about it. Oh, China has problem. Europeans start to panic. They close down their borders. They never had a pandemic like this in modern time. America panicked and closed down the borders, but it was already here, and we follow suit. But closing down, what does it mean? It means that governments are taking up powers that they're not supposed to have overnight. That you can't just say, oh, people say there's a pandemic in China. We don't have any proof that we have it. We don't have any proof that we have a pandemic, but we're going to shut down every activity in the country. And that gives government a new sense of power that it's not supposed to have in a democracy. And we're talking about democracy. But the real problem is, how can we change our policies? Can we have a new direction in our politics towards health, towards education? You can talk about health without talking about education. You can talk about education without talking about budget allocation. Can we make changes in this direction and go forward? I think that's the main issue for me. Political, I think the governments will stay. I think, as we say and as we see it, they pass a lot of little small laws under the table before anybody that nobody knows. Money that's coming in, nobody will know what happened to it. We've seen in Liberia, the case of Ebola money is still going, it's still gone. That's going to happen. And the governments will probably ramp up their powers to control the population more, the more they can get. As government law of control. That's what I know. And therefore, I think, I'm sorry to say, but looking at what is happening in Africa is going to be, let's try to they will go to the World Bank, they go to the IMF, they go to China to try to find new money, new loans to make new flashy projects, and then get it re-elected, and then we go back to status quo.
And Dr. Doug, I want us to talk the political component of post-COVID-19 and also the politics. Let's make them a single package, because in some way they are a little related. So looking at the economy in Africa that has been a little more reliant on the Western world in terms of importation, we import more and export less. And what we see now is, there are serious restriction as a result of the pandemic. Movement has slowed. I believe people might be getting imports, more slower than usual, and it's all impacting locals. I'm sure these things are leading to increase in prices of basic commodity. Given all this that we're learning, how should we, or structure our economy or make economic decisions for our own benefits, not to be relying on the West?
Well, not to be relying on the West is saying, okay, we are not going to function when we have natural resources. We are not going to use the concession model that Farsoon brought into Liberia in 1926. That is still existing, and that has actually conditioned everything we do. That people come and take raw material and then go refine it and bring it back and sell it to us. So we actually work for them. So how do you change that? This is what I'm saying, that, I'm sorry that probably because that we have this new democracy that allow people to say, okay, you have 4 years, you have 5 years in power. So whatever you do, as long as you build some houses, you build few highways, you're okay. You can talk about development, but you don't go back to the source of the problem. When you talk about underdeveloped, what are the issues? I think that the focus should be, how do we break away from the West? If we not breaking away, it doesn't mean, no, we're going to close the door. What makes China today? China went through a cultural revolution. They locked themselves up for 20 years. They created the institutions, and now they came up big. Africa has never done that. We went from being a colony And next day to be independent, but we never got the result of independence. Because look at this. The colonialists left, they took away the burden that they had on them to control those countries, to run governments. Africa became independent. They didn't have the burden to pay for the government for social services, but they kept the same companies that exploited the continent are still doing the same thing. So in the trade-off for independence, we only took the burden. We never got the advantages of it. And the advantage of being independent is to be able to control your local resources and create local money, create local power, local wealth. If you do that, then you move. But I don't think we're there yet. I think, I'm sorry to say, but I think we may go back to the status quo, which is worse than where we were 20 years ago. Because we owe a lot of money to everybody. Africa owes $150 billion to the IMF, World Bank. They owe China, just in 2017, China gave Africa $147 billion in loans. How dependent can you be?
Same question, Baker, politically and economically.
Politically, there has been some positive light coming from a couple of countries. I'll give a case in point. Botswana. Botswana has recently just passed some policies whereby they're focusing more on hiring local people as opposed to hiring foreigners for most jobs. They've actually curtailed foreigners from doing certain types of businesses within the country that the locals are in position to actually do. I think that's a positive. Looking at Kenya, they are promoting build. What's the slogan? The slogan is "Buy Kenya, Build Kenya." Yeah, the slogan is "Buy Kenya, Build Kenya." So the President Uhuru Kenyatta is injecting a stimulus of about 53 billion Kenyan shillings, and part of that, he specifically said they're supposed to buy cars, but the cars are supposed to be cars made in Kenya. He said they're supposed to buy hospital beds, but they're supposed to buy hospital beds made in Kenya. So I think some of the leaders are waking up to the reality that we can't always depend on our brothers and sisters in the West or those in the East, which is a positive thing from that perspective. Then going forward from an economic standpoint, we are looking at a lot of import substitution. With import substitution, that means we have to manufacture things locally in the African countries. Previously, we have always had a problem. We tend to consume what we don't produce and produce what we don't consume, which is a problem. So we need to have that adjusted going forward. If we are trying to promote industries and value addition, instead of just sending out raw materials, that is going to call for energy. Energy is the engine behind industrialization. We cannot be able to manufacture things if we don't have a reliable source of energy, which brings us to the issue of Africa needing to explore other sources of reliable energy other than oil. We've seen that oil prices have taken a very huge dip. Now, if you look at a country like Nigeria, which is highly dependent on oil revenue, they're already bleeding because oil right now, the prices are below zero almost. Oil refineries, people dealing in oil are actually paying people to help them take the oil away from the refinery. So we need to look at alternative sources of revenue for countries, first of all, not to be dependent on one particular source of revenue. We need to look at alternative sources of energy, and Africa is blessed with lots of sunlight. We need to explore solar energy as an alternative source of energy to be able to power the industries that we are trying to finally wake up to promoting. We need to look at the issue of tourism. Tourism has been bringing in a lot of foreign exchange for very many African countries. but the situation as is, tourists are not coming anytime soon. So we as Africa need to look at promoting domestic tourism, which is something that most countries have tended to neglect. Every time we talk of tourism, it's a matter of inviting people from Europe, US, wherever, to come and visit Africa. But there is an untapped market, because I'll tell you what, you find somebody who's born in a little town, they grow up and die without ever visiting the next town. And that is very prevalent in most African countries. Somebody is born in a little village, they don't even cross over to the very next village to find out what is there. You know, you'll find a tourist coming into the country and they know more about the country than the locals of the country. So we need to promote domestic tourism, and we need to brand Africa, because when the flights finally come back to life, it's going to be very competitive in terms of tourism. We need to actually brand ourselves. We need to learn to tell our own story and not wait for CNN to tell the African story for us. Actually, CNN was set on fire. You're in Atlanta, you know what's happening with the riots. So supposing CNN is no more tomorrow, who will tell the African story? We need to create platforms that are African so that we control the narrative. We brand ourselves. We need to rebrand, because we are primarily poverty and disease. That's our face. So we need to rebrand. We need to change the narrative. How do we change that? We need to use our own platform so that we are able to control the narrative. And in terms of education, we need to look into studying our history as a people. The reason why we don't believe in ourselves as Africans is we've been indoctrinated by the Eurocentric education system that everything that comes from the white man is what is best. We normally joke about it with my friends. We say the white man's ice is colder. So we need to teach African people their history so that they know who they are as a people, where they're coming from, how great they are as a people. African people have invented very many things around the world. Philip Emeagwali is known as the father of the internet. He's Nigerian. We have Africans, Black people who have, there's Dr. Drew, is a Black American. Dr. Drew, Charles Drew, is the one behind blood banks and transfusion. We have people like Ben Carson. These are Black people. So we as Black people need to believe in ourselves and the ability to find solutions that can ably handle the challenges that we are facing. And if we can do that, then we stand a chance. Otherwise, as is, America is having its own problems right now. It can't look into problems elsewhere. China is having its own problems in-house. It's not about to look at African problems anytime soon. So we need to look for local solutions, and we need to believe in ourselves.
Do you think, may I ask this, do you think we can do that in the current political climate? The neoliberalism, globalism, where people are so, our leaders are so connected. I mean, every year they go to China, they go to France, they go to France Union, France Africa, Europe Africa, Turkey Africa. Do you think we have the leadership now on the continent to do that Afrocentric political development thing?
What happens is the current crop of leaders, most of the African leaders, if you take a quick swoop around, they're above the age of 70. These people have been in power for no less than 10, 15 years on average. They've been sucked in by the Western world and the Eastern world. So if any of this is to happen, we need a new generation of Malemas taking over across the entire African continent. We need the Kagames and people of that lot to be able to take up the mantle of leadership, because otherwise there's nothing that we can do without good leadership. Leadership is the key to all these ideas. We can talk all day long, but if the leaders that actually hold the power are not of this mindset and are not willing to sacrifice to make these things happen, we definitely are going to make very little progress. You mentioned China. China, Chairman Mao came up with the Chinese plan they're trying to roll out 100 years ago. That's when they came up with the Chinese plan that we are seeing the fruits of today. So we need to have a generation of leaders who can roll out a 50-year plan, a 100-year plan, because these kinds of things that we are talking about are not about to happen overnight. Because one of our main impediments is that Africa as a continent is not rich in terms of liquidity. We have the mineral resources. Unfortunately, we actually are gifting them to Europeans. We are giving them the diamond mines and everything. We do have the resources, but we don't have the liquidity right now. That's why we keep running to IMF and World Bank to get the loans. And we need to know that he who pays the piper calls the tune. If the Western countries are still funding us, a case in point, look at the African Development Bank, 62% of the voting rights or the ownership of African Development Bank is 9 European countries. So
exactly. If I may stop you, since you're talking, I think we can change on this, because when you talk about African, I was going to raise that issue that Africa doesn't seem to know that it can create institutions of its own. I can give you, I work on project with, AU, but everything they do is financed by somebody else. Every research that AU does is financed by somebody else, and usually it is the same people from outside who come to do the research for AU. It's a shame.
60%
I work on a project, a continental project.
Speaking of the AU, 60% of the African Union budget is funded by Western powers and Eastern powers. The very building in which the African Union sits is a donation from the Chinese. As a matter of fact, after building the thing, they wired it with cameras. And every other discussion that was happening in there was being fed directly to China. That was something
I wrote an article on that 2 days ago. I published an article on that issue.
Okay.
Exactly.
So Dr. Deshu, on top of the question being asked that Dr. Duke and Baker responded to, I'm also asking you, on top of that, what kind of leadership do we expect to see in Africa after COVID-19?
I think, as far as what we are accustomed to seeing and what we should see, those are two different things. I'm going to stay on. I prefer to answer the question with respect to what I think we should see. I think we need to, we've different versions of it have been basically talked to addressed during this meeting or presentation. I think that the thing that comes to mind, we need some sort of security. You gotta have health security, and it's best to focus on the things that you can do and you do have some control over. We do have the ability to make our own drugs. Okay, we also have the ability to make drugs that are off patent. So again, technology is universal. There are many people, Africans, that have studied this stuff and can certainly do this stuff. It's not unique to just Europeans or what have you. Okay, the technology, the idea of drug manufacturing, there are many Africans involved in that. And they can certainly produce off-patent drugs, say to treat malaria. These things can be done because they, first of all, a lot of them are not even patent protected anymore, so they can be done by anybody, anywhere. It's a matter of prioritizing resources for them to do that. Secondly, you can also then go into, we have herbalists in pretty much every single African country. You can read about that with one click of Google. You can see that pretty much there exists all over the continent. Some countries have done better in terms of bringing those herbalists and naturalists and what have you into the fold, and traditional African medicine, essentially. So how do we make sure that we apply some of the things that we know are universally safe to do? We can apply good science even to a traditional African medication. There's nothing because at the end of the day, if someone, and we've seen this from example, it doesn't matter whether the drug is generated in Africa or is generated, by a European or from wherever. As long as people get harmed, that's going to be the end of it. The government becomes the boogeyman and what have you. So we need to make sure that the drugs are safe, whether it's a traditional African medication or if it's European based. So we don't need foreigners to do that for us. We can do that ourselves. So there are people post-COVID discussing that right now. The African Academy of Sciences, they are, exploring initiatives to go down this route, the route of generating money from clinical trials. So that's one of the initiatives that they're doing. They're trying. That's right now. Most of the clinical trials and sites are done in Egypt and South Africa, pretty much predominantly in Egypt and South Africa. A lot of the clinical trial sites on the continent are done in clinical trial research in just those two countries. So there's an uneven distribution of resources. So that's one thing we can do. Try to increase the availability of and fund clinical trial sites all over Africa in different African countries. But along with that, you also have to have regulatory oversight. You need to have food and drug regulatory oversight. You need to make sure that the clinical trials are done safe. You need investigational review boards established in each of those countries. You need data and safety monitoring boards. Because like I said, the worst thing that can happen is people die from the clinical, they have good intent, and we start doing these trials based on African medicine or any other drug that is off patent, and and people die from that, and then it gets a bad rep. And so those are things that need to be put in place. Those are things that some countries, like I said, the African Academy of Science is already working on. So those initiatives are in place. The other thing is, just like health, you also have to talk about food security, right? A lot of countries, for example, you take rice and maize in Eastern Africa. Those are you can't do anything without food and health security. Everything follows that. So you can do, not just genetic breeding, which I don't want to get into that. We know there's issues and pros and cons, but beyond that, just traditional interbreeding, right? That we've done for ages in Africa. You crossbreed different rice species, different maize species, corn. We need to do more of that so that we can have our own food security. We need to stockpile on food, and same way that we need to do the same for drugs, different drugs, by making it ourselves. And then the same, like I mentioned earlier, you have to plan for infectious diseases. You have to assume that there's going to be another outbreak. After COVID-19, you have to pretty much assume that this is going to be a way of life. I think Kabanda mentioned that. So basically, we have to learn to live with these things. So you have to plan for that by stockpiling, PPEs and supporting our hospitals and what have you. And all of that stuff takes money. And I mentioned earlier some of the ways that we can generate money. Clinical trials cost a lot of money to conduct. If you were to start doing those, that could be one way you could generate some income. The other way you can generate income is if we go down the route of looking at all these herbs that many of us have used, growing up and what have you. If we look into commercializing that, which we should, you then have the issue of protecting it and what have you. You can generate money within a country. For example, I gave the example of Liberia. We have, many people don't know this, but we actually have a patent office. It's called LIPO, Liberian Intellectual Property Organization. We have those in many African countries also. Most of what they do, however, is basically registration of patent rights. They don't really examine patent applications. And so by not doing that, they're not generating enough fees to be self-supporting. That's another way you can generate money, and also generate interest in science. Anybody can become an inventor. A high school student could invent the next drug to treat malaria, but we need to encourage a culture of that. And somebody comes up with something, then they go through a patent examination process. They get charged a fee, they pay a fee. Most of those organizations are self-supporting, and that's how we can encourage innovation and ingenuity, African-based ingenuity. We have to give people incentive. And that's one of the ways we can do that, is to offer them some sort of protection when they spend their resources and what have you to come up and with some, drug to treat or some formulation, herbal formulation that they think would work to treat, say, some sort of inflammation. And that, I personally have used when I was growing up in Liberia. There was one instance where I went to the hospital for probably 3 weeks with all the different Western medication. None of that worked. And we went to, I guess, what you would call a herbalist. And within a day, 1 day of taking what she gave us, I was able to, the injury I had was to my wrist. I couldn't do anything with the wrist. Within a day of taking the mix, she went, basically collected some leaves, put that together. I rubbed it overnight, and basically by the next morning, the wrist was completely healed. Something that hadn't happened in 3 weeks of going to taking all of the anti-inflammatories. So we definitely have medications in Africa and solutions for things like that. We just have to figure out a way to prioritize the commercialization of those things right there and to trade, inter-African trading and what have you, and it can be done. I mean, and that's the sort of thing I think we need to engage in. The last point I also had on mine, coincidentally, I had it on my list of things that I made, was controlling the narrative. I think that's a very interesting point that Kabanda Baker brought up. At the end of the day, you want to control the narrative because it encourages the kids now to think, like innovators and inventors and what have you. I know we usually typically focus all on science and engineering and what have you, but I think you don't want to neglect the literary arts, language and literary arts also, because they help to tell the story. You have to, make movies, plays, and all of these things, because it basically will help to conscientize people, kids, the next generation, to think in this way that, we can do this. People have done it. Other people have pulled themselves out. The Southeast Asians were faced with a lot of the same problems we are faced with today, and they pulled themselves up. So can we. It's just a matter of prioritizing.
Thank you. That's the She folks in cyberspace. You are watching Focus on Liberia, and we are discussing post COVID-19 Africa. This disease is here, like many other diseases in the past. It will go. How will Africa look like in terms of health, economics, and politics? Let me come to the only lady in the room. Koto, you're listening to their fellow panelists. As I was listening to them carefully, the possibilities are there within ourselves as human beings because we do have the potential. One thing sometimes people look up to is leadership. And this time around, I'm not only talking about political leadership. People who are expert in their respective fields, can we trust the current breed of Africans to say, hey, if you are a business person, can you start a bank? Can you start a 500 or Fortune company today in Africa? Do we have it in us to do these things? She smiles. You on mute, Kado. You on mute.
I'm hoping that I don't have to answer that question that says, do we have it in us? Yeah, that's a very loaded question. But what I'd like to talk about is the global reality that within months of COVID-19 spreading across the globe, the social and economic policies followed by most governments for close to 4 decades are being questioned. So the advantage for countries and for people in terms of demanding their civil and political rights, economic rights, is in the failure of this. I'll come back to the neoliberal economic model. The failure of this model is shown clearly in the impact of COVID-19 on people, their livelihoods, their survival during this time. So I think post COVID-19, there are several things that we have to look at. So one would be ensuring the economic survival of the most vulnerable people. And this means that governments organizing their relationship with the citizens would have to prioritize social protection. And social protection means that there are services, that people are supposed to have to be able to live a predictable life. Social protection as it relates to labor, to care work, to public services. So that would be health, water, food, having mentioned food security. So this is something that governments will have to incorporate into their relationship and their accountability to its citizens, to their citizens. And the reason I highlight this is not because of COVID-19. This is work that has been done, over decades, where you have civil society organizations, you have movements that are definitely demanding these things as their rights. So we are asking that governments include this, including the government of Liberia. So you all know that across the continent, everyone is developing a stimulus package. The government of Liberia has developed one. They have not followed through unless they intend to do that started by tomorrow morning. They have not followed through. And we've had COVID-19 and the lockdown since April. So what is it that stops them from doing it? And what is it that makes it normal? There's no lack of accountability. Why is it normalized within our societies? This is something that we have to work on. I think the other thing is to ensure that when governments decide that they are going to work on support to businesses. So after COVID, there's going to be, in fact, as we see now, there is economic crisis. Let that economic crisis or response to the economic crisis include small and medium businesses and households. So in Liberia, think about the context of market women who basically had to shut down, small businesses had to shut down because of the lockdown, and they no longer have the sort of cash flow and resources that they depend on to live on a day-to-day basis. So we would prefer to see that kind of action, that kind of response that is looking at the economic survival of the most vulnerable people. The other thing is about, and this is more at a macro level, that African governments would address the issue of debt payments, because to be able to invest in social protection, it means that you must have the resources to do it. At this moment, it is critical to recognize that governments may not have the resources, but it does not mean that the IFIs will come back, or even development banks will come back and say, okay, you don't need to pay your loan at the moment. So if this is not coming from the IFIs, it's important that governments become proactive and say, for example, let's suspend debt payments until 2022. And if this is done on a, say, for example, multilateral basis, where you have most countries saying it across the continent, what is going to happen? It means that you've gained some sort of traction that they cannot, ignore. So I believe that this is something that should happen. I was also looking at the issue of, long-term, that government should produce or should establish a progressive taxation system regime that is going to support public health. And it comes back to some of the things that Harvin has been saying, that the more resources we have, it means that we're in a better position to be able to build a system around innovation, improving the resources that we have, improving the system, improving the quality of delivery. So it's important to be able to look at the issue of taxation. And I think the political side of this, someone mentioned it, I think it was Dr. Ducle, is the issue of leadership. Who are our leaders? What do they aspire to when they think about the quality of the system that they work in? So I've heard people say, Liberia should start to think about, post-COVID activities. So do some analysis, develop a document that is going to be relevant to post-COVID Liberia. However, if we're going to aspire to a system that has failed, and we're not thinking in innovative ways, new ways that we can then, as the government play its role, or as citizens in playing our role, it means that we go back to square one. And the whole issue of having a pandemic, looking at multiple and intersecting crises, that isn't going to go away. So I think it's important to look at what do we do about the economic crisis that we find ourselves in? What is the leadership that is available to do that? And how do we look beyond this failed neoliberal model, economic model that we depend on? What are the new ways of working? What are the new things, alternatives that we're putting forward, not just within our countries, but across the continent and globally?
And Koto, before you end, because you mentioned the neoliberalism maybe a couple of times now, so let's just jump into a little bit. Are you trying to, I don't want to make excuses for African leaders, but you're looking more of that being because of external factors?
I don't think it's external as much as it is I don't want to say the go-to system, but this is the existing dominant economic system, within the world. So there are countries that are the exception where they say, no, we're not going to buy into this. We're not going to take loans from the World Bank. We're going to be, innovative in terms of our different systems. I really like the fact that having brought up the issue of food. So that national sort of reliance on the systems that we have, it's possible, but I also believe that if we come from that place where we say another world is imperative and it's possible, then it means that the issues that we have, say for example, the issues we have in Liberia, they're not much different from the issues in Uganda when it comes to social, political, and economic rights. And it's not much different from what's happening in Kenya. You see the context currently in the US, the whole idea of, the protests, the, police brutality, all of these different things, they're not just, unique to a particular country. So if we decide that we want to do an overhaul of these systems that we've been using either for governance or for, sort of economic support to people, then it's something that could become a wave. In the same way that we embrace it, it's the same way that we can say, no, this does not work for us again. And it happens in many forms. And it's not, like I said, it's not happening because of COVID-19. This is work that people have done for the last, 3-4 decades.
Understood.
Yeah.
3 decades.
Yeah.
3 decades, I would say, yeah.
Yeah.
Can I make a point on that? I think, this is the issue that I was always trying to raise, that vacuum of leadership. And then when you talk about it, say, okay, it's happening in the last 20 years, since the 1990s. We had the founding fathers, and then you had the generals, and then you had democracy sweeping through Africa in the 1990s. We never sat down to create grassroots institutions to support democracy. We just walk into it like a recipe. Somebody say, oh, you need to have election. We're no longer going to allow coup d'etats and all of that. You need to have democracy. What is democracy? We don't know. It just means electing somebody and then having 60 people in the House deciding laws that don't make sense at all. So we embrace a system that was given to us with the background of the colonial system. We came out of the colonial system, the vote buying, the secretary, they talked about communism, they talked about socialism, but they didn't know what it was. They never took time to say, we are not going to be Chinese or Russians, or we're not going to be Americans. We are Africans. What can we develop? So Africa never developed its own ideological concepts of independence, of self-sufficiency and development. So we got we put ourselves in a trap. And that track is carrying us into a really disastrous place unless we change it. So I agree with you.
Asuni?
All right. Let's come to the issue of social services in Africa. These things have been not to the satisfaction of us all. How can we attack them or approach them, to use the right word, so that, looking at education too, all the social services, internet is a problem in Africa for the most part, uh, electricity, roads, all these problems. How do we as Africans attack them so that we can improve these services to better the lives of Africans? And let's start with you this time. Baker, let's start with you. The man who is dreaming for a better Africa, to make Africa better, the social services, the roads, and internet connectivity. You are having issue with your internet, earlier in the show. How do we make this thing better so you can live your dream?
So, dreaming is good, but we need to wake up and actually take some action. Dreaming won't get us there. Mm-hmm. Regarding the issue of social services, you just mentioned the internet. Facebook, MTN, Orange, China, and I think Egypt, and a bunch of other partners are working on a project called To Africa. To Africa is a subsea cable project that is going to avail high-speed internet to the African continent. And this project already has funding. The funding is already available and work is in progress. It should be completed by 2023, hopefully. So if by 2023 we have high-speed internet, that will be, a big plus for the African continent, because as we speak now, I think we are the continent with the least level of internet connectivity. We are in the fourth industrial revolution. Things are moving at supersonic speed and everything is technology. We're talking artificial intelligence, we're talking blockchain, we're talking robotics. We've always received the memo late. We come on board when it's too late. To this moment, we're just remembering to enter the industrial revolution. We're just remembering to begin manufacturing masks locally in our country. But with the internet and with the internet coming on board, I think we need to look more into technology and how it can be used or leveraged for education purposes. Right now, with things such as COVID, we are speaking of social distancing. We are speaking of things like working remote. Definitely, we are going to need the internet to be in our midst to enable this revolution, or to enable us get some fruit from the tech revolution. We are talking about the economy. If at all we can get internet and better policies around technology enhancement and promotion, certainly jobs can be created. The internet the internet opens you up to the whole globe. Look at Amazon. Amazon is doing business with the whole world. So if Africa can be opened up to the internet, our boys and girls have the capacity to do work. You can create a website for Mr. Dennis when he's in Atlanta and you're all the way here in Uganda. You don't have to go over there. You can design a logo for him. You can design an app for him. So certainly technology needs to be looked at by our leaders. Unfortunately, most of our leaders are, like I said, they are in the evening of their years, which brings up a problem. They don't consider these things such as technology as important. It's the young turks who are so into the tech revolution. So we certainly need to have our leaders look into technology as a driver of development, as a driver of jobs. And we need to address the issue of food security, like Dr. Victor mentioned. We need to grow food so that we can feed our population. And most importantly, we need to look at food storage. Most of the African countries don't have food storage. We don't have silos. In Uganda, we wanted to supply posho to the families that were locked indoors. So the government decided to supply posho and beans, but getting the posho and beans was a problem. enough to supply the entire capital city and the neighboring city. It was nowhere to be found. So food security is something we definitely need to look into. From a global perspective, we are still speaking social issues. There's something happening to the Black people in America. They are rioting, and a gentleman called Floyd was killed by a police cop, and there are riots going on all over the place. What does this bring about? There is a conversation around repatriation. African Americans are looking at coming back onto the African continent. They're looking at Africa as a possibility of a place where they can go and thrive and live in peace and harmony. The question is Africa ready for the diaspora? I know the last time such an experiment was done in Liberia, African Americans showed up, and you and I know what happened. Are we ready for them this time? And speaking of the African American spending power is $1.3 billion. So, wait, $1.3 trillion. If they were a country, that would make them the 12th richest country in the world. We are here looking for money. How about we partner with the African Americans? They have a heavy wallet. They have the skill set that we can use to develop the vaccines that we are looking for on the continent. So certainly that's something we need to look into, because that's a conversation that is being held in America. You had the 400-year return in Ghana, and lots of African Americans went there. They had a good time, and they're excited to come back to the continent. So that is something that we need to also factor into a post-COVID Africa. The post-COVID Africa is seeing African Americans look into Africa as a possible place for repatriation and a possible place for starting a new life. So that is something that we need to also plan for in terms of the social setup of Africa. In America, there is racism. In Africa, we have tribalism. We haven't addressed tribalism. So what happens if we get an extra tribe of African Americans added in our midst? How do we handle that? So that's something that we also need to think about going forward.
Thank you. Koto, after every crisis, like we had a civil war, so we have demobilization supposed to take place. People need to be de-traumatized and all this other issues. So the war, for instance, in Liberia left back a lot of social issues that we're dealing with. Now with COVID, what do we expect with the issues of girls and the vulnerable population? We also see that schools have been closed for a long time now. So what do we expect? What are some of the social issues and the educational issues that may come about as a result of this COVID? When all is said and done, what do we expect to see?
Yeah, I am of the firm belief that the issues that came before COVID-19 will remain constant. The only difference is that there will be more awareness and hopefully, more opportunities to be able to address these issues. And this would cut across many different, social and economic disruptions that have been caused by COVID-19. So definitely there will be the issue around labor, women's labor. And this is not just informal spaces. If you look at the percentage of informal workers that we have in sub-Saharan Africa, I think it's close to 90%, and maybe more than 50% of that is women. So that would be an issue that we will have to pay attention to, but it's also something that existed before. So for example, the ILO has been doing a lot of work with women movements, feminist movements, trade unions to ensure that governments are developing, a quality environment for women workers. So whether it's women who work in the factories or women who work in the markets, that has been important. So I'm not sure, whether you've heard of the ILO Convention 190 that was ratified last year. So there's a lot of work that is being done around that. But then there's also the labor that is done within the domestic spaces. So governments, I'm hoping, will start to think about how do they invest in public services that will support women in the work that they do around the home. So, for example, childcare, issues around transportation, water. What is it that we do about it? And I'm saying this because with COVID-19, it has become clear. It's almost like in our countries, things have come to a standstill, and where you have movement. For example, you say there's a lockdown, all of the different public health responses, stay at home, wash your hands. You see that even those public health responses are not realistic. Why are they not realistic? How do you tell me to wash my hands when I don't have water? How do you tell me to stay at home when I don't have, a home, or I live in a home where we're more than 10, perhaps in a small 2-bedroom apartment? You cannot talk about social distancing in that context. But it's even worse when people have to rely on going outside of their homes to be able to fend for they and their families. So you cannot say it's a lockdown and you cannot come out because it's going to affect the spread of the virus. So I think it has become clear, like I said before, COVID-19 affirms the struggles that we fought in around people's economic rights. I think the other issue relates to, violence against women. I know you've had many shows that talk about violence against women, but I think the whole issue of increased confinement, isolation, the closure or shutdown of particular services, protection services, that is something that the state will have to look at. Like right now, no one is going to court, I'm not sure whether that is happening in many countries. So if someone gets raped or there's an issue of domestic violence, you may most likely hear that this is going to wait until after the context. But if you think about domestic violence in a space where your home is not safe and the person who's the perpetrator is actually an intimate partner, then that is something that exacerbates the situation. So I think it's really important for governments to take note of the consistency of these issues post-COVID-19 and pre-COVID-19 and post-COVID-19, and then develop the different systems that will respond to this. In the context of education, education is such a intersecting area. So it's not just about going into the classroom and the teachers available to teach you. It's about what happens to you by the time you leave your home, if you can leave your home, because we know that there are many people who many girls cannot leave their homes to go to school. What is the sort of protection you get when you're in the school and when you're returning home? So there's a lot of work that has to be done in terms of improving the systems that we work in, and we have evidence. So COVID-19 is evidential of all of the problems that we have been talking about, whether it's the feminist movement, the trade unions, women organizations, civil society organizations. This is what we said that we did not want to get into. So this is not just a public health or medical crisis. It's really a global crisis that is, multiple and intersecting. And I think it's really important that those who are responsible, elected, civil servants, it's important to start to look at how we use the country's resources to be able to respond to these things. And then they become, not just a unilateral establishment of a new system. It's about bringing other people on board to be able to support the process and ensure that it works based on different contexts.
Thank you. Dr. DeShiel, as Koto was speaking, the issue of education was reinforced in my mind. Right now, what we call e-learning, virtual learning, online learning, is not possible today in our country. And the simple reason is no reliability of internet and electricity. So our students are home, whereas in Western world, the children, I stay having lessons because they have the infrastructure and the tools to learn online. Uh, is this something that we're going to say, you know what, I think we get it this time?
Well, I mean, if you don't mind, I want to just go over quickly the prior question you asked about social services because I think it's related to that.
Thank you.
So I think first of all we have to decentralize the availability of social services, right? It has to be decentralized. For example, in many African countries, everything's focused on the capital cities and what have you, right? You have to provide incentives to college educated people to live in other parts of the country so that, and then also followed by the appropriate resources. But you have to create some sort of incentive for those people to relocate to different parts of the country and not just all focus on just the capital cities because you then have way too many people trying to access very limited resources and also you don't then improve other places. So I think decentralization is important. The second thing is also as far as quality of services. There's two aspects of that. You have to find a way to measure it. One of the ways to measure and quantify that is, for example, in Liberia, we don't have we do census, but we don't have what's called like a unique identified number, right? In America, a social security number. That's important because how do you quantify, the degree of the quality of the service that you're providing? If you can't, if you have these the unique identified numbers, you can get a better handle on how well you're doing that. You have to be able to measure things in order to improve them. So that's one of the reasons we need those things like that. It might seem simple, but it's connected to many different things, including, for example, the issue of people reselling land, plots, and what have you. A lot of things are connected to the government, the inability of the government to even do things like contact tracing. It's linked to some of these things. You don't have a unique identified number, so you can't really measure how well you're even doing, delivering your services. That's one thing. The other thing I think that stares us in the face, you have to pay people better, right? If I have 10 people it's been said that for every single person that's employed in Africa, they probably have to support, you can call it anywhere between at least 10 people. Okay, it's relying on that one person to support them. So if you want better services, it has to come with better pay. We have to pay better compensation to people in order for them to provide us better quality of service. That it goes hand in hand. I don't think we can sort of ignore that, neglect that, and what have you. That's something that needs to be addressed fully because we all know that so many people are depending on that one person to show up for work, even just to get to work in a lot of those countries. A lot of the money is spent on just transportation costs, but yet we expect this person making relatively meager salary from the government. I was only speaking in terms of the government to do those things. A lot of places also we don't have what we call like a minimum wage, right? You pay people just high what you feel like paying them. As far as private sector, even when we do have minimum wage laws, they're never enforced. They're never enforced strictly. So therefore, you're never going to get like a relatively, you have to do those things so that I think a lot of it is connected to the quality of the service that you're going to get, whether it's private, public, or an organization that's like a mix, a hybrid of private, public. If we don't link it to better compensation in terms of enforcing our labor laws, in terms of just making sure that the government itself is in America, for example, and European countries, a lot of them, they have these skills. If you work for the government, there's different, depending on someone's education and all that kind of stuff, you must pay them a certain compensation. We don't have those kind of things. And when we do have them written down, it's not followed. Different people make different salaries. There's no uniformity in compensation. So as a result of that, it affects the quality of the service, the social services that may be provided by that person, right? You can imagine that if you show up, it can be pretty much expected that a human being will behave that way. Of course, I do understand that some people, regardless, however money, it may not be linked to salary. It's just they're just bad at their job and it simply don't provide good services. But that's why you have reviews, annual reviews and things like that to address those issues. But I think a lot of it has to do with just sometimes the poor, mediocre pay and compensation. And then I think, let me see what else. Okay, yeah, the issue of the internet availability. It's not only, it's a great idea. I love that Baker mentioned the idea that someone can be sitting in Kampala and providing, earning good living, providing services for someone all the way in Atlanta. And as a consequence, the governments can then charge, they can get revenue from that, right? That's income. But how do you, if you don't have a unique identifier number, how does the government track people like that to make sure that they're paying? Kato mentioned the idea of progressive taxation. All of that is predicated on your ability to collect taxes, right? You must be able to collect the taxes so that it can then help all of us. If someone's making, pretty good money doing something like that, but the government has no way of even, ensuring that they can collect tax from that person, doesn't work. The internet also, widespread availability of the internet also helps for knowledge sharing, which addresses what you were asking. Knowledge sharing is key, right? If you're going to build, for example, do better agriculture, the small countries like Denmark, I believe, I think they have like 5 million people and they supply something like 35% of the world's agriculture products come from that little country. A lot of what they do is highly scientific and technical, right? In terms of the farming that they do, everything from moisture, water, everything is all app-based systems and very highly regulated. A lot of technology applications. So that's one of the things that the availability of the internet everywhere, whether you're in Banga, whether you're, wherever you are, Sino, you should be able to do commercial farming and if we have the internet available to people, they can say somebody wants to go into cocoa production, they can learn how to do that properly just from having access to the internet. So the internet and its availability can help to improve agriculture and animal husbandry, better ways of doing those things. With respect to why technology applications, for example, the ability to learn from home, that's certainly something that we could do. I think on the last call we had, it was mentioned that even if the students didn't have those things available in their homes, we could at the very least we should have centers all over in all of the counties where students can go to and access the internet, right? Community centers where they should be able to go to access the internet to then sit there and listen to lectures. Or even if they went to their schools, right? Their schools should, in their auditoriums or what have you, they should be able to supply those things and make it available, where the students can congregate every day, like they might have to do so on some sort of social distancing protocol, where maybe they go in 10 at a time, spread out. 30 students, they go and listen to the history lecture or the chemistry lecture, what have you. So, we have to invest in those sort of things to be able to do that. At least community-based investments, even if we can't do it home, on a home basis, we can at least have centers, technology centers, and the schools can be better equipped to provide, those sort of services also. And that will include things like teaching people how to learn how to install solar panels. And we could certainly do things like that in Liberia. There are Liberians that I know that they have solar panel installing companies. They do those sort of things. I'm sure they'll be willing to provide their services in terms of improving the vocational, modernizing the vocational education at the high school levels. If you do those things, it will help to spur students to maybe, you know, after they finish high school, they may, even if they want to go to college, they may see, you know, vocational education and starting a company producing solar panels all over the country. They could do something like that, you know, so that we can have a way to provide electricity on a decentralized basis.
Thank you.
So those are the kind of things I think we can address.
Thank you, Dr. Deshire. Well, and we are almost out of time. We'll ask my last question to Dr. Duke, and then we can conclude. But before that, let me read a few comments on Facebook. Dave Giles say, how can Africa build a strong economy without the dependency on foreign aid? How can a continent of over 1 billion people continue to survive at the mercy of others? Dr. Duke, you happen to be one of the movers and shakers of the continent. What are you doing to bring together like minds? And he also, River says, Pro say, what is post-COVID? The virus hasn't even started in Africa. Another wave is projected to be coming. And Dave concluded by saying the better pay goes to only politicians who are just talking. What is preventing us from implementing these great ideas? How can those barriers be overcome? And Dr. Duke, my question to you on top of the comments is, quite recently we saw what's happening. It started in Minnesota. I don't know to what extent the lockdown had to do with the way people have responded to the flood issue. And so that brings me into Africa, where after the pandemic, how we're going to respond if there are issues like that or some form of inequality that the people see. I think from our last program, we talked about the power grab by those in authority. They're going to use this COVID to do some backdoor deals and move some things. And Dr. Deshire is also a legal person. You see, there are some cases pending. I was born in a town called Dodwicken, where you have to send cases to Greenville, depending on how severe they were. Due to the pandemic, I don't think anybody's going to do that. So those cases are going to pile up. I don't know how the people are going to live with those who have done them wrong if they are not able to seek justice because of the pandemic. So looking at all these legal issues and the power grab and how people are going to respond, do we expect to see more protests because people got very angry and God forbid even uprising after COVID? Yo, sorry, you are on mute. Unmute yourself, please.
Okay. First, I think Minnesota, I think the Minnesota issue and whatever is happening all throughout the country in the U.S., it concerns all of us. And I think the issue it has to do with COVID. People being locked down for 3 months, 2 to 3 months. First time something happens, they have been angry. And, you know, Black people have been angry for a long time. But now it's not just Black and, this is not a racial war. It's not between Black and white. It's about police brutality against white people, Black people. And you have to take it that point. That's the main issue. And it's how Black people are seen in America and how they are perceived and how the police that has been created. The police in the US were created to protect white people against the Blacks. That what you got to remember that. There was no other reason to have the police. There was a police, of course, but the main function after the 60s was to protect the whites against, the Blacks. So they're going out is normal. People may say, yeah, looting will happen, rioting, but Martin Luther King said, rioting is the arm of the people who cannot be heard. Nobody hears you, so you go to that. Coming back to Africa, I think the problem we have, we've been playing firemen from 1960. People come and tell us, you have this problem, and then let's go solve it. After that problem, yes, you have this problem. People tell us what is development. We don't even know what development is. We talk about problems that will come after these things. People talk about it, but a lot of companies who lay out a lot of people. Every sector, they're going to lay out people. They've been 3 months, and that's why because we don't have a sense of African issues, that this is Africa's problem and how do we solve it? Because you look at it, we jump on a train that has already left. We don't know, we still don't know what is COVID is in Africa. We don't know what is, what kind of mutation is out in Africa. We just shut down our whole continent because China did it, because Europe did it. But we don't have any study. And they send us study guides and this and that, do this, do that. And tomorrow we're following the same thing. And then we come out broke because our economies are going to shrink by 2 to 3%, something that it took us 30 years to build up. And this is where China can play a leadership role, because Africa now owes China something like $300 billion in debt. You come out of these things, and then you have accumulated another debt, internal debt that people have broke, no jobs, nothing is working. How do you rebuild Africa? How do you start with Africa? What's the role? People are talking about, we're going to find 500 million, 300 million, 1 billion. No, Africa needed $1 trillion or more.
All right.
But that's my point.
Thank you, Dr. Doak. We have hit 2 hours, which is our max, and a very good, spirited, and insightful conversation from you. I learned a lot today. And so we will get at most a 2-minute concluding statement from each of you, and then we will call it a day. Let's start with the youngest in the room. Hey, wake up, stand up, the dreamer. Don't stop dreaming, though. So your final thoughts that you want to leave with us, go ahead. You unmute, Baker. Thank you.
Every challenge produces an opportunity. Every cloud has a silver lining. COVID-19 seems to be a challenge, but if we handle it properly, it could turn out to be a blessing. It's a wake-up call. We need to look towards ourselves to provide solutions to our problems. We need to grow our own food. We need to manufacture our own medicine. We need to employ and empower our people. We need to work on our leadership. We have always been dependent on Big Brother US, Big Brother China, but COVID-19 has showed us that the person we can depend on is none other than ourselves. So if we can take that as a lesson and follow it up with actions that help ensure that we don't fall in a similar debacle going forward. I mean, somebody mentioned the second wave of the COVID-19 happening. And even if it doesn't happen, 5-10 years from now, another pandemic will happen. So let's not get caught off guard in case a similar situation happens. Let's prepare now. Let's build the Africa we want. And aluta continua, struggle continues.
All right. Let's come to Koto. You heard a young man saying the struggle continues. Please, don't give me that struggle. Give me something inspirational with your closing. Give me some hope here. You're on mute, Koto.
I assume that I had been giving hope. The possibility of change and the possibility of overhauling a system that no longer works for us. I think that is an opportunity. And because of the lived experiences that we have globally across the continent in our different countries, it's clear that what people are asking for during this pandemic is not, just medical, or it's not just medical. People are asking for more things. They're asking for food. They're asking for freedom of movement. They're asking for protection, amongst others. So I think the realization that as citizens, we are entitled to our rights, and that right is, those rights are inherent. It's not a favor given to us by governments. This is something that should happen, and the resources of the different countries, belong to all of us. It's not just for the elite, political figures. It's for everyone in the country, and it should be distributed equitably. So I think that is one opportunity. So that mass movement that is moving towards systems change that started before COVID-19, I think it has gained some momentum that is not going to slow down. I also wanted to, within the 2-minute period, to talk about the need to acknowledge what is happening on the continent with respect to COVID-19. And I don't think the resilience, the low numbers that we have, the high recovery rates, and if you look at different factors in terms of the sort of geographic placement of the disease and the, where you have high numbers on the continent and where, in countries where you would not expect to see, lower numbers, you've seen that. I don't think it's happening within a vacuum. So the knowledge that we have, if you listen to all of these different podcasts and conversations happening online, people are reaching out to the lessons learned from different, pandemics, from Ebola. Ebola was an epidemic, not a pandemic, I'm sorry. But people are looking at that. I was in Liberia and I led the Ebola efforts of ActionAid International. And at the time, people could not travel. So there was no one who came from the international office to support Liberia to fight Ebola, ActionAid Liberia to fight Ebola. So now they're calling and saying, what were the processes you went through? What was the protocol? What were the different steps you took at the level of policy? What is it that you engaged the government of Liberia on? And if we're talking about respecting our knowledge on the continent and building on that, I think it's really important that we recognize that. The fact that we don't have high numbers does not mean that we're not going to have a second wave. It does not mean that we'll not have more people who are going to get infected, but there is a story that is being told. If you look at the numbers in the United States of America, we started this conversation saying that our leaders go to these countries to get health care, right? Because they believe in those systems. If they had to go now to New York City to be able to get support, medical support around COVID-19, do you think they will take that opportunity? And it's a rhetorical question. So we need to rethink the way we look at, the resources that exist on the continent, both, intellectual resources and what we've been able to build as citizens. So I'd like to stop and say that it is an opportunity that we have. And I end most of my, participation on the topic of COVID that I am looking forward, I'm really looking forward to what's going to happen in the next 6 months, but really starting from January 2021, I believe that there will be a significant shift in terms of how we're thinking about the future. And it's most likely we'll still be in similar context, but people have a lot of time to sit and think and, rethink, review everything that has been existing and say, how can we make it better? And I'm sure you're all in that situation. So let's continue to do that and, understand and appreciate the resilience and the knowledge that we have in Africa around COVID and how we can improve on that. Thank you.
Yeah, thank you. Dr. DeShield, would like the other be the other be the last. I'm trying to be a little traditional here. Let the other be the last. So close us.
So I think a lot of this between everybody else, they've kind of mentioned a lot of things, but I would say for me, the things that I see that we really need to do, number one, we need to focus on something like, say, for example, food security. We talked about interbreeding of different species of, say, cassava, rice, maize. Without food security, a lot of trouble starts. So we need to stock up on those things. Take the same approach to infectious disease. We need to stock up on the production of our own PPEs, right? And production of our own testing kits and medical equipment. So those are those two things. And then we also need to look into modernizing our vocational training at the high school level, right? You can teach high school students how to do coding and writing, software for apps to solve different African-based problems. And we can have our own solutions to African problems starting at that level. We can teach those kids how to do biofuel production, how to make that from cassava. You can do those sort of things where you can use those fuels to power machines and other equipment. You can also do what's called geothermal cooling. All of that stuff can be done at the high school level. It takes dedication, but you can modernize your vocational training starting from that level. So that's something else that we can do to vocational training and stem cell education. The other thing I would want to mention is we have to look into why is it that we have high net worth individuals in Africa, but there seems to be a disconnect between having incubators. All right, so a lot of these things we don't need to reinvent the wheel. We have to find out why is it these guys don't put their money. What do we need to get them to put their money to back some of those things? The government can't fund all of these things. We have these super rich people. What can we do to incentivize them to invest in, incubators, to have one, say, in every county in Liberia, where you encourage entrepreneurs to go in there and you have public-private money funding these companies that entrepreneurs come up with so that we can create jobs. With the creation of jobs, you get political stability. So that's essential. We need to focus on entrepreneurship. And the last thing I would mention is we also need to, a lot of these things can be done, but specifically, we need to start to develop our own biotech and pharmaceutical companies to make drugs that are off patent. They do it all through Asia. They do it in South America. There's some parts in Africa are doing that already. For example, if you want, whether it's chloroquine you want to make to treat malaria, you can do that. There's nothing stopping you from doing that because the patents that protect those drugs have expired ages ago. That means anybody can make them. So why is it that we don't make those drugs that are off patent? Why is it that we don't encourage and form biotech companies with the government help, public-private, so that we can make our own chloroquine instead of always, and then in addition to that, look into developing, and making and make manufacturing on a large scale basis, our own African herbs. All of us are taking Jolobo, right? We know that it works. You might not like it, but it works. Without a doubt, it works. I don't think anybody will question that. I mean, so why don't we look into, ramping it up large scale? We can do things like that, and then we can look into making sure it's safe. How many cups do you drink? You rather want to drink 10 cups, 5, different body weight, different, when you go to the drug, when they write prescriptions, they write it based on your size, your weight, and all that sort of stuff. So those are things that we can look into and that we should do, because all of these things will stimulate economic activity within Africa. We need to focus in our own countries. And like I said, we need to do what we can do, right? We need to do what we can do and not worry so much about external forces. I mean, they're always going to be there, and they may not be serving our own interests, and we all know that. But the things that are under our control, or that we have some basis or some means to effect, we should be doing those things. And a lot of these things I mentioned, I think it might seem daunting. I know most times when I mention some of these things, people say, you're talking about producing drugs when people don't even have food to eat. Well, you have to think a little bit beyond that. If we do interbreeding of crops, we will have food to eat. If we have silos, it will create, we will have food there, and it will create, stability in the country also.
Thank you very much. Let me come to you, Dr. Du, for your closing statement. Whatever thoughts you have to close with, I want you to play emphasis on our institutions making a change after COVID-19.
Well, changing institutions depend pretty much on the political leadership of any country or any place. So if you want to change your institutions to make them productive, to meet the needs of your community, you have to look at your leadership. Are they ready to do it? And last time we were here, I think Dennis asked me a question. It was, kind of joking way, but those Africa need a revolution. I said, yes, that's what we need. I think we need a revolution. The revolution is not always a violent gun shooting and all of that. The Reagan brought a revolution in the US in 1980, in the 1980s. He brought his idea of a new government, new form of government. This is followed by another revolution that took place in the 1960s by Kennedy. So the countries change all the time. We have gone through change in Africa. We went through the founding fathers, we went through the generals, and now we are with the neoliberal global, who are all into the global thing. How do we get out of it? If you don't get out of it, if you don't give Africa its own sense of direction, if you don't have people who can inspire us, I can ask anybody online now, how many African leaders do you know compared to the 60s when we knew every African leader by name because they were inspiring people every day. Either they fought against each other or they fought somebody, we knew who they were because they're inspiring people. We don't have that today. Everybody knows Kagame, but that's one person. And you have an AU that is dysfunctional depending on foreign aid. ECOWAS is doing its best. It's probably, I think it's the best organization on the continent. The SADC has not met so far on the COVID because the Tanzanian president has not called one single meeting since the beginning of COVID. These things happen. So how do we recreate Africa? The whole notion, when my friend from Uganda say he's dreaming, we also dream, but we all dream about the same Africa, an Africa that we are proud of, an Africa that, Black Americans will fly to go see because that's it. Yeah, my ancestors came from this place. I'm proud of it. I'm going to spend some of my money here instead of going to Paris or instead of going to China. How do you create an Africa where students go to school, they have internet access, they have water to drink, they have lunch, and they go home happy to do their homework, and then go back to school and knowing that someday they'll create something that will develop Africa? That takes a new form of leadership, not with this kind of leadership we have today, which is totally the neoliberal leadership involved, totally embedded into this globalism. Globalism has not worked for Africa. We've been under it from 1846. We've been under globalism. We've been colonized. We've been independent, but the only thing we got from independence was the burdens of independence. You support the government, but the resources still go the same way. So how can we change that? Unity, transparency, a new form of leadership. And yes, Dennis, we need a new revolution.
Okay. All right. On that note, we need a revolution, maybe a Bernie Sanders kind of revolution that is yet to come to pass. Maybe that's
right.
what we need. That's what the dad is talking about. Folks in cyberspace, thank you for following our broadcast here. I want to join, let me take the leeway in thanking you, our panelists, for your expert, honest opinion. You provided a wealth of knowledge. This video going to live on for long. We will recommend it to leaders to use this as a resource document. Why they are club with the authority to study affairs of our nations across Africa, to transform the Africa so that the Africa my friend Baker is dreaming for. I want to see that Africa, and I think then it does as well. Mr. Ja, that will do it for us. Close us.
Well, I want to thank all of you for coming and engaging in this very, very thought-provoking discussion. Remember, it's COVID-19. So I want to thank all of you for joining us today across the internet. Thank you so much. We've discussed COVID-19, what we expect, how we look at Africa, and then 6 years down the road, play this video, and then come to think and say, I wonder if I will look in the future. So, culture in Kenya, I know it's like after 1 a.m. now, also Baker in Uganda. Thank you so much for sticking with us. Keep your dial here set at Focus on Liberia. We educate, we elevate, and promote all things Liberia. Until then, from all of us here, we say, have a good and godly night. Thank you. And bye-bye.
Thank you.
Thank you. Thanks to everybody.
Bye everyone.
Bye-bye.
Goodbye. Becca, Jack.
Yeah, let's take precaution. To the hospital.